My name is Edna Laurent-Tellus, and I'm the CEO and founder of Awake IntuMind.
And I'm Dr. Karen Abdool, and I'm the founder and director of Beryllium Psychiatric Services. And we're so excited to bring to you the amazing world of holistic mental health. We're proud to be part of a rich tradition spanning millennia that has incorporated herbs and other nutritional elements, exercise, healthy sleep practices, community, and spirituality into mental health care. Today, with the discoveries of modern medicine, plus our traditional practices, we have the tools to boost the mental health of our communities, families, and ourselves. We're thrilled to have you on this journey to great mental health. Come along with us. Today, we're going to talk about actually one of my favorite topics. That is the mental health risks and how they affect not just the mind and the emotions, but also the physical brain, which is an organ, and most people don't think about it that way when we think about mental health, but we have a physical brain, and also how it affects our body. And this is going to lead us into really the discussion on the greatness of using holistic methods and a holistic approach to heal mental illness and to really be restorative in terms of mental health.
I'm so happy to be with you today, Dr. Abdul, to talk about that. It's very exciting because um, when we think about, the brain and the body, a lot of time we separate, the two. We're not seeing the brain as an organ, and the psychological effect, that a lot of things externally or internally having on the brain, and also um, in terms of the system, the mental health system. I know the last time we talked about, right now there's a more integrative, approach where we're talking about the mental and the physical, which was not been done before. So we're moving really a little bit more toward holistic, looking at the whole. So I'm really happy to be here to really look a little bit into that with you today.
Wonderful. Um, Edna, I was wondering if we could start off talking about the impacts of different kinds of um, mental health risks. Like, what are some of the risks? What are some of the things that might cause someone to deteriorate in terms of their mental health?
Great question. And I'm going to really focus a little bit more on the psychological effect. Um, and I know you can go deeper into the physical as a medical doctor. So when we talk about the risk, in terms of mental health, is that all of us, when we are born, we're born from a family. And from the family, there may have been some history of mental illness. And mental illness, it can be something that it's more chronic, let's say, to the point where the person is really delusional, they don't, we said psychosis, in terms of the person really are not in touch with reality because their brain is really so damaged that the way they see things, they hear things. For example, people can be hearing voices, seeing things that are not there. So it's really based on a lot of chronic issues that, it's genetic, it's from family history that, they may have that affecting their behaviors. Another thing, also it's the environment, what going on in our environment. Those are risks. So stress, chronic stress. Chronic stress is really one of the issues that contribute to somebody become depressed. anxious. And those are the things we're seeing. So chronic stress. So all those things have an impact on our brain and our psyche. So somebody, can be isolated, even if you are in a community and you don't feel that you belong. It's like, you're there, but it can be nobody look like me or understand me. There's a lot of things that can cause isolation, and that really is a risk, to someone's mental health. Trauma, some people know about sexual trauma, physical trauma, emotional trauma. Those are things that really, if they are not addressed, they can really have lasting effect on somebody's mental health. Substance abuse. A lot of time we don't really think about the physical or, again, psychological effect that putting those things in our body, in our system, how they can affect us mentally, changing the way we're thinking, the way we see things, our mood, all those things. And physical health, in terms of people can have chronic, illnesses, and they kind of like, oh, that's not a problem, no, but somebody who's really have chronic, physical health, that can cause them to be depressed, to be anxious, and have other mental health condition based on what's going on with them. So in a way, when we're talking about those risks, those are the things, we're talking about. Somebody go to a divorce, they lost a child. Okay, all those things, are risk that we in the field are seeing that are affecting people, and they are coming in to get, if they cannot get over it on their own, they may need some professional help, to really heal from this risk and conditions.
I love what you're saying, and I think my sweet spot is in helping us think about actually the reverse. You talk about the various physical things that can, influence our mental health, and contribute to, the deterioration of good mental health. But I think a lot of us don't realize that when our mental health deteriorates, it affects our physical body in some very concrete ways as well. That is something that we're not taught necessarily in psychiatry to make clear to patients. So perhaps the most concrete example I could give of that is, sometimes when people have a stroke, they can develop psychosis. And as I said before, the brain is an organ, and changes to the brain, damage to the brain, will produce certain types of mental issues. However, on the flip side, we have noticed that, for example, trauma, chronic anxiety, depression is also related to physical changes in the brain. For example, the hippocampus, which is the seat of concentration in the brain, shrinks when you get depressed, when you get anxious, when you're stressed, people suffering from post-traumatic stress disorder. And one of the first things to go and one of the last things to recover when someone is depressed or anxious, etc., is concentration. It's one of the most common complaints we hear. But we don't think about it as a structural thing, but that's really what's happening. Another piece of this is that the immune system becomes deeply dysregulated. And while we don't have all the answers to these questions, we know that in areas of the brain that are responsible for producing the healthy chemicals that help us to maintain our joy and our peace and stay calm and not anxious, when people become depressed and stressed, there is what we call hyperinflammation in the brain, meaning your immune system goes into overdrive and it knows something's wrong, and it, goes there and starts kind of churning out all the things to correct it, except it's, very difficult to correct. And that hyperinflammation actually also contributes to poor mental health. So, you know, these are ways that, the entire body's physiology, the hormonal system, even the way your blood circulates, and, the gut. We talk a lot about gut health in overall mental health. But I think what people don't realize is some of the receptors and things that produce our happy emotions are located in the gut. So when you have butterflies in your stomach, when see the person you're in love with, or when your stomach starts to feel pain and you start to feel, you know, sick to your stomach when you're anxious, it's actually dysregulation of the very same chemistry that is being dysregulated in the brain. So everything in the body is interconnected. And one of the things that we say in Beryllium Psychiatry, and it's one of our mantras, is mental health is whole body health. The entire body is disrupted in mental issues, and the entire body needs to heal in order for the person to achieve mental health.
Going back to what really we are doing here, we are looking at holistic health. And that's exactly what it is. To be holistic is really to be able to look at all those aspects when healing. So how do we really heal holistically, mentally? How, all those, you can say, risk factors that are associating with causing the mental health issues. But again, if we know and we understand it's a physical, um, um, basically, it's a physical thing. It's not like, okay, it's psychological, there's no physical things happening with the psychological. People will understand that it's not really just talking about them. It's more like, if you have a headache, I tell people, if you have a headache for like a day and you can take Tylenol and it goes away, you're fine. But if you have a headache for like a week, 2 weeks, 3 weeks, 4 weeks, you really need to check it out because we were not made to be able, to have a headache and there's nothing else, going on behind it, because all symptoms are just an indication that something is not right with the internal.
Mm-hmm. Yeah, and that actually brings us to one part um, of psychiatry, really, where we talk about, and some people may have heard about this, quote unquote, somatic symptoms, which are physical symptoms that people experience that are indicators of the stress they have or indicators of um, uh, illness. And I talked about the gut and gut health, but irritable bowel syndrome, we found, is one illness that's very closely associated with depression, anxiety, stress, and trauma. And in particularly traumatized populations, there is increased risk for it. Their headaches, we have stress headaches, cluster headaches. In fact, the Cambodian community I worked with, when I worked with the refugee community, they did not have a word for depression in their language. So their word was chikaba, which meant my head hurts. And that's how they communicated that there was a mental problem. But there are other illnesses that we don't think about that rise and increase in traumatized populations, and we will get into that when we do a deep dive into trauma. But they really reflect a strong connection between the balance of the body and the balance of the mind. So, in different traumatized groups, there's an increased risk for things like obesity, uh, diabetes, those kinds of illnesses, because the body's metabolism goes out of sync as the stress increases or persists. So you talked about genetics, which is part of it, but stress on an entire community can cause the persistence of a lot of physical illnesses related to the mental illnesses. And so the question becomes, how do we use uh, these holistic methods in the community as part of this process of healing? And I was hoping that, um, Edna, you could talk a little bit about the role of spirituality in healing both the mind and body and what that might look like.
If we talk about holistic, looking at mind, body, and spirit, we are all spiritual beings. We have a body, mind, and spirit in the sense that even ourselves psychologically think about when we are thinking, we think, but we can talk to ourselves. There's another, it's kind of like those all those little elements, things that we cannot explain. How does that happen? If I'm depressed and there are thoughts coming to my mind, I can talk to myself to really address those thoughts. So for me, spirituality, when we're talking about that, it's really more what make us as human being, what make us really say, like, life is worth living in terms of my purpose in this life. So spirituality for me really is a sense of purpose. And usually how it's reflect itself is to our hope, our inspiration, um, how we see ourselves navigating this world as um, a um, a spirit that connected to our community, how we live our life, like our everyday life. And there's more like that higher purpose is not only just like I'm living for me, but it's more for the good of the community in general, because we are all connected.
Yes. And when we think about taking care of ourselves, there are a whole lot of practical ways that we take care of ourselves that we don't really think about when it comes to mental health. Nutrition is one of the key um, supporters of good mental health, and directly affects our ability to produce the things that our body needs to keep us feeling mentally well. Exercise is another big brain health boost. And, you know, there are lots and lots of studies now being done on the role of exercise in mental health. But people don't really understand, it's not really being taught just how it helps the body and the brain to survive and to heal and to improve. Sleep is so important. Um, in fact, without sleep, people can literally die early. That's how impactful it is. That's how important it is for the body. Um, and then, our community is a key part. Actually, it's actually one of the only pieces of holistic health that I really learned about in medical residency as being super important to help patients improve and heal. The three pillars of treatment that we learned were medication, therapy, and community support, family support, friendship support, the whole community, spiritual community support, as being the three things that were definitely, when working together, most able to benefit patients. So even the wider medical community has accepted the role of a supportive social environment in improving mental health. And we should, as we're here, talk about medication and therapy because they are part of holistic treatments and they have their role. And they do things that do, change the brain and change the neurochemistry. So they are an important part of mental health care. But incorporating the other parts is something that our community needs to understand. So today we really discuss the deep interconnectedness between the brain, the body, and the mind, and how they're all related to good mental health and poor mental health. We looked at the role of holistic methods of healing, which include good nutrition, exercise, sleep, and a strong community, in addition to spirituality, in healing an injured mind and body. We also talked about the fact that there is a good role for medication and a strong role for therapy as well. And those, in addition, are a part of holistic mental health care. Our question for thought today is reflect on one thing you learned about the relationship between your body, brain, and mind, and how they support your mental health. And we do have a challenge for you today that's going to lead us into a topic for next week. And that is, what does spirituality mean to you? This week, journal a few sentences every day about your spiritual life journey. And you may be wondering why we're going to talk about spirituality and why we're actually starting off with spirituality as the first part of our holistic mental health journey. And I want to toss that question to Edna. Edna, why are we starting with spirituality?
That is a very good question, Dr. Abdool. And I know it's easy for people to understand when we said holistic involve good nutrition, exercise, community connection, sleep, and all that. But when it comes to spirituality, people may not really see the connection with that. One thing that people really need to understand that pretty much, there's no us without, putting the spirit as part of it. So that's why in my practice, anybody who come and practice to me to heal from trauma, especially from trauma, I cannot leave the spiritual piece of it, outside of it, because that's what makes us who we are. Our next talk, we can go deeper to really look at the importance of spirituality in healing our mind, body, and soul. I'm really looking forward to have that conversation to people in our community.
Absolutely. Thank you so much for joining us. We're so excited to continue this journey with you. And we look forward, please just drop into the chat any questions you have, your thoughts from our question for thought. And we would love to hear from you about how things went with your challenge. Were you able to journal every day about a spiritual journey? Do you currently practice one? If you weren't able to journal, what made it hard to do? We look forward to hearing from you, and we look forward to having you join us next time on Healing Roots, a journey into holistic mental health. Thank you and goodbye.
Thanks. Bye.